If you are between 60 and 85, ordinary movements can reveal something your birthday cannot. Which part of everyday independence is strong today and which part may deserve more attention? One test takes 30 seconds. One takes only 10. And the final test can challenge people who felt confident after the first 4. Stay with me through all 5 because your total score is not the most important result. The real answer is the pattern. Strong legs can hide a balance problem. Good balance can hide a difficult turn. A quick walk can hide limited endurance. And in test 3, I will show you how someone can beat the stopwatch and still notice a warning sign the timer completely misses. Before you move, collect a firm, straight-backed chair, a phone or stopwatch, supportive shoes, a piece of tape, and a pen and paper. Place the chair against a wall so it cannot slide. Clear pets, rugs, cords, and small furniture from the area. Keep a stable counter nearby. And if possible, ask another adult to stay beside you. Do not use a swivel chair, rolling office chair, folding chair, recliner, or low sofa. If you normally use a cane or walker, keep using it whenever the test permits your usual aid. Never remove support just to improve a score. These are educational self-checks, not diagnoses. Watch without participating if you have recently fallen and still feel unsteady, have been told not to exercise, recently had surgery, have a new injury, or cannot stand safely. Stop immediately if you develop chest pain, faintness, severe or unusual shortness of breath, sudden weakness, new numbness, loss of balance, or sharp pain. If any symptom feels urgent, seek appropriate medical help. On your paper, write the numbers 1 through 5. A green result earns a check mark. If you complete a test but notice something concerning, add a circle. The check tells us what you completed. The circle tells us how you completed it. And one more rule, a yellow result is not a failure. It still completes your independence profile, and it may give you the most useful information in this entire video. Let us begin with the chair. Test 1 is the 30-second chair stand. This test asks whether your legs can repeatedly lift your body from a chair without your arms doing the work. That matters when you rise from a toilet, get out of bed, stand from a dining chair, climb steps, or get out of a car. Use a firm chair with a seat close to 17 inches or 43 centimeters high if one is available. Keep it secured against the wall. Sit in the middle of the seat. Place both feet flat on the floor. Keep your back upright. Cross your wrists and place your hands on opposite shoulders. If that arm position is uncomfortable, fold your arms gently across your chest. Do not push from the chair or your thighs during the official test. When I say go, stand fully, then sit down with control. Count only complete stands. Continue for 30 seconds, but stop if you feel pain, dizziness, unusual breathlessness, or loss of control. If you cannot rise without using your hands, do not force it. That is already a useful result. Stay seated for the countdown, and I will give you a safer starting version afterward. Ready? Go. Find a steady rhythm. Stand tall, then sit with control. 20 seconds remaining. Keep breathing. Do not hold your breath. 10 seconds remaining. Stay controlled. This is not a race against another person. 5, 4, 3, 2, 1, stop. Write down the number of complete stands. The age-based references are appearing on screen. I will read them once so you can compare. For ages 60 to 64, the reference is at least 14 stands for men and 12 for women. For ages 65 to 69, it is at least 12 for men and 11 for women. For ages 70 to 74, it is at least 12 for men and 10 for women. For ages 75 to 79, it is at least 11 for men and 10 for women. At age 80, use the 80 to 84 reference, at least 10 for men and 9 for women. These numbers come from the CDC chair stand assessment. A score below the age and sex reference is a screening signal associated with fall risk. It is not a diagnosis, and it does not tell the whole story about your health. If you met your reference with good control and no concerning symptoms, place a check beside test 1. If you were below the reference, needed your hands, or could not safely begin, leave the check blank. Do not label yourself weak. Chair height, arthritis, pain, recent illness, body size, and technique can affect the result. What matters is whether the task has become harder than it used to be or is interfering with daily life. Here is the safer starting practice. Keep the chair against the wall. Place your hands on the armrests or your thighs if needed. Lean your chest slightly forward, stand once with control, then sit slowly. Rest. Repeat only as many times as you can do without pain, dizziness, or loss of control. If standing is difficult, a physical therapist or qualified exercise professional can help you choose an appropriate starting level. Now comes the first blind spot. You can perform well on the chair test and still feel uncertain when you cross a dark room or step onto uneven ground. Strength can lift you, but strength alone cannot keep you steady. Test 2 is the Four-Stage Balance Test. Balance is a conversation among your eyes, inner ear, brain, nerves, feet, joints, and muscles. This test gradually makes your base of support narrower. Your eyes remain open and each position lasts no more than 10 seconds. Stand beside a stable counter with your spotter on the other side. If you cannot stand safely without a cane or walker, do not remove it for this self-check. Watch the positions instead and ask a clinician or physical therapist which balance assessment is appropriate for you. For the first position, place your feet side by side so they touch, or as close together as feels comfortable. Your spotter may help you get into position. Once you feel steady, the spotter lets go but stays close. Ready? Begin. 3, 4, 5. Keep your eyes forward. 8, 9, 10. Stop. If you stepped out, grabbed support, or could not hold the position for 10 seconds, stop the balance test here. Do not make your stance narrower. If you were steady, move to the second position. Place one foot slightly forward so the instep of that foot touches the big toe of the other foot. This is sometimes called a semi-tandem stance. Ready? Begin. Keep breathing. Let your ankles make small corrections. 5 seconds, 8, 9, 10, stop. If you moved your feet or needed support, stop here. Your last safe position is your useful result. If you were steady, prepare for the third position. Place one foot directly in front of the other, heel touching toe as though you are standing on a narrow line. Choose whichever foot feels more natural in front. Keep the counter within immediate reach. Ready? Begin. Look at one fixed point. 5 seconds. 7, 8, 9, 10. Stop. This heel-to-toe position is the key scoring point. The CDC notes that an older adult who cannot hold the tandem stance for at least 10 seconds is at increased risk of falling. That does not predict that a fall will happen. It means balance may deserve more attention. The fourth position is standing on one foot for up to 10 seconds. It is part of the full progression, but you do not need it to earn the check in this video. Attempt it only if the heel-to-toe position felt secure, a spotter is present, and you can reach the counter immediately. If all three conditions are true, lift one foot only an inch or two from the floor. Ready? Begin. 3, 4, 5. Stay close to support. 8, 9, 10. Stop. Place a check beside test 2 if you held the heel-to-toe position for 10 seconds without moving your feet or taking support. Treat the one-leg position as extra information, not a reason to take a risk. If the tandem stance was difficult, practice the last position you could hold safely. Stand beside a counter with your fingertips hovering over the surface. Hold briefly, rest, and repeat. Safe balance practice should feel controlled, not frightening. Now notice what the balance test did not ask you to do. You did not rise from a chair. You did not walk. You did not turn. And you did not sit back down. Daily life combines all four. The next test combines them too, and the turn in the middle can reveal something a final number does not. Test 3 is the timed up and go. You will need a standard armchair and a clear walking path. Measure 10 feet or 3 meters from the front of the chair and mark the turning line with tape. Leave enough open space to turn safely. Sit back in the chair. Wear your usual footwear. If you normally use a cane or walker, use it. When the timer begins, stand up, walk to the line at your normal pace, turn, walk back, and sit down. You may use the armrest to stand because that is part of the standard setup. Your spotter should walk near you without pulling you or setting the pace. First, perform one untimed practice round. Stand, walk to the line, turn in the direction that feels natural, return, and sit. Take your time. I will wait. If the practice round felt unsafe, do not perform the timed attempt. The difficulty you noticed is more important than a number. If you are ready, reset the timer. The clock begins when I say go and stops when you sit back down. Ready? Go. Stop the timer as your body settles into the chair. Write down your time. According to CDC steady guidance, a timed up and go result of 12 seconds or longer suggests an older adult may be at risk for falling. For this video, a time under 12 seconds completed steadily and safely earns a check. But this is where the stopwatch can mislead us if we look at it alone. Imagine a 72-year-old woman we will call Margaret. Margaret is a teaching example, not a real patient record. She cooks for herself, walks most mornings, and completes this test in 11.6 seconds. If we looked only at the timer, her result would appear reassuring. But at the turning line, Margaret stops. Her feet take several small shuffling steps. Her shoulders and hips rotate together as one stiff block. On the return, her fingers brush the wall. She finishes under 12 seconds, but the quality of her movement asks a second question. The CDC assessment instructs the observer to notice postural stability, stride length, sway, tentative pace, shuffling, little arms swing, steadying on a wall, and turning the whole body together. These observations do not create a diagnosis, but a new or worsening change can justify professional evaluation. Review your own attempt. Did you take unusually short steps? Did one foot drag or fail to clear the floor? Did your feet seem to stick during the turn? Did you reach for the wall? Did you drop heavily into the chair rather than control the final sit? Did your spotter feel the need to catch you? If any answer is yes, draw a circle beside test 3, even if you earned the check. The circle means the number did not tell the whole story. That circle may be more useful than a perfect-looking score. If you want to practice the sequence, slow it down. Work separately on standing with control, walking toward a clear target, making a wide turn with several deliberate steps, and reaching back for the chair before sitting. Do not practice fast turns if you feel unsteady. You now have information about strength, still balance, and functional mobility. You may think walking speed has already been tested. It has not. The timed up and go includes a chair, acceleration, a turn, and a sit. Test 4 removes those parts and measures the pace you may not notice changing from year to year. Test 4 is a usual pace 4-meter walk. Measure 4 meters, which is a little more than 13 feet. Mark a start line and a finish line. Keep extra clear space beyond the finish so you do not have to stop suddenly. Wear your usual shoes and use your normal walking aid. Have a spotter nearby if there is any concern about balance. Stand comfortably with both feet behind the starting line. Walk at your normal everyday pace as though you are moving through a store. Do not race. The timer begins with your first foot movement and stops when your leading foot reaches the finish. Perform one practice walk first. Return slowly and rest if needed. Now prepare for the timed walk. Ready? Begin. Stop. Write down your time. 4 meters and 5 seconds equals 0.8 meters per second. Research commonly uses a usual walking speed below 0.8 meters per second as a marker of slow gait in older adults. The meaning can vary with age, health, height, population, and testing method, so this is a screening reference, not a diagnosis. For this self-check, 5 seconds or faster, with a steady pattern and no concerning symptoms, earns a check beside test 4. If your time was longer, treat it as a yellow result. Repeat it on another day when you are rested using the same shoes, walking aid, distance, and timing method. A consistent change over time may be more meaningful than one isolated attempt. Now look beyond the timer. Did both arms swing naturally? Did both feet clear the floor? Was one step much shorter? Did you drift to one side? Did you become unusually breathless over this short distance? If you noticed one-sided dragging, sudden instability, pain, or another concerning change, add a circle beside test 4. A sudden new walking change accompanied by one-sided weakness, facial drooping, confusion, severe dizziness, or trouble speaking is not something to exercise through. Seek emergency medical help. If your pace has gradually changed, possible contributors include pain, reduced activity, vision changes, medication effects, foot problems, nerve changes, or heart and lung conditions. A healthcare professional can help identify the cause. Do not assume that every change is simply age. You now have 4 results. But independence is not only the ability to complete one short movement. It also depends on reserve. How long your body can continue before fatigue changes your posture, breathing, foot clearance, or control. That is why the final test lasts 2 full minutes. Test 5 is the 2-minute step test. This is the most demanding test in the video. Skip it today if you have unstable heart or lung symptoms, have been advised to limit exertion, cannot march safely even with light support, or felt dizzy, faint, painful, unusually breathless, or unstable during an earlier test. Stopping for safety is always the correct choice. Stand beside a wall and a stable counter. Find the midpoint of your kneecap. Then find the top of your hip bone. Place a piece of tape on the wall halfway between those 2 points. That tape marks the target height for your knees. During the test, march in place and raise each knee toward the tape. Count only the number of times your right knee reaches the target height. If your balance is reduced but you are otherwise safe to participate, you may use a table, wall, or chair for a light touch hold. Do not pull your body upward with your arms. You may slow down or briefly pause, but the timer continues. Stop immediately for chest pain, faints, severe or unusual shortness of breath, dizziness, sudden weakness, loss of balance, or sharp pain. Ask your spotter to count your right knee if possible. If you are alone and fully safe to proceed, count aloud. Ready? Begin. Find a comfortable rhythm. Lift, place, 15 seconds. Keep your body tall and breathe now. 30 seconds. Check that your whole foot is landing safely. 45 seconds. Keep counting only the right knee that reaches the tape. 1 minute. You are halfway. This second minute is where physical reserve begins to show. 75 seconds. Notice whether your feet are beginning to scuff or your posture is collapsing. Control matters more than speed. 90 seconds. You may slow down. Keep breathing. 105 seconds. Stay close to your support and keep each step deliberate. 20 seconds remaining. 10 seconds. 5, 4, 3, 2, 1. Stop. Hold the counter or sit down slowly. Let your breathing settle. Do not walk away immediately if you feel lightheaded. Write down the number of times your right knee reached the target. The published reference provides age and sex-specific cutoff scores described as predicting physical independence. These are screening references. They cannot decide whether a person can live independently, and they should never be treated as a verdict. For ages 60 to 64, the reference is 106 for men and 97 for women. For ages 65 to 69, it is 101 for men and 93 for women. For ages 70 to 74, it is 95 for men and 89 for women. For ages 75 to 79, it is 88 for men and 84 for women. At age 80, use the 80 to 84 reference, 80 for men and 78 for women. If you met your reference without unsafe symptoms or loss of balance, place a check beside test 5. If you were below the reference, had to stop, or could not safely begin, do not repeat the test today. Endurance can be influenced by recent activity, heart or lung health, pain, illness, medications, sleep, and many other factors. A low or declining result is a reason to ask questions, not a reason to feel ashamed. Now look at your paper, because the 5-test mystery can finally be resolved. If you have 5 checks, you met the selected screening references for leg strength, static balance, functional mobility, usual walking speed, and physical reserve today. That is encouraging. It is not a guarantee against falls, illness, or future change. 4 checks suggest several strong areas and 1 clear place to investigate. 2 or 3 checks mean the pattern matters more than the total. You may have strong legs but reduced balance, or a steady stance but limited reserve. Those are different problems and need different responses. 0 or 1 check does not mean you have lost your independence. It means these unsupervised screening references did not match your current function, or that a more individualized assessment may be useful. Now look for circles. A circle means you completed a test but noticed something the stopwatch could not explain. Shuffling, reaching for support, 1 foot dragging, an uncontrolled sit, pain, unusual breathlessness, or a sudden change. A circled result can deserve more attention than the total alone, especially when the change is new or worsening. That was the lesson in Margaret's example. Her time fell below the CDC's 12-second threshold, but the turn revealed a movement quality concern. The timer answered how long the task took. It did not answer how her body completed it. Now find your weakest link. If test 1 was lowest, leg strength or power may be the limiting area. Ask whether chairs, toilets, stairs, or getting out of a car have become harder. If test 2 was lowest, stability may deserve attention. Consider vision, footwear, foot sensation, medications, dizziness, and whether supervised balance training would be appropriate. If test 3 was lowest or circled, transitions and turning may be harder than straight walking. That can become noticeable in bathrooms, busy kitchens, narrow rooms, or crowded places. If test 4 was lowest or circled, your usual walking pattern may be changing. The important question is not only, how fast was I? It is also, is this different from 6 months ago? If test 5 was lowest, short tasks may still feel manageable, while longer errands, shopping, housework, or walking outside drain your reserve. This is why your total was never the real answer. Independence is a chain. The weakest link can determine which everyday activity becomes difficult first. Do not try to fix all 5 areas tomorrow. Choose the lowest or most concerning result and take 1 calm next step. If a change was sudden, severe, one-sided, or accompanied by chest pain, fainting, new confusion, trouble speaking, or severe shortness of breath, seek prompt or emergency medical care as appropriate. If the change has been gradual, write down what you noticed and when it began. Bring that information to a healthcare professional. Ask whether medications, vision, feet, joints, blood pressure, heart, lungs, nerves, or recent illness could be contributing. If you feel generally well and want to improve, ask for an appropriate plan that includes aerobic activity, muscle strengthening, and balance work. Those are the 3 types of activity emphasized in healthy aging guidance. The right level should challenge you without making you unsafe. Retest only occasionally under the same conditions. Use the same chair, walking aid, shoes, distance, and roughly the same time of day. You are looking for a pattern over time, not chasing a daily high score. And remember this: needing a hand, a cane, a higher chair, or a slower pace is not a personal failure. Independence does not mean refusing help. It means using the right support early enough to keep doing the things that matter to you. If you are comfortable commenting, you do not need to share your age or score. Write only the test you most want to improve: chair, balance, turn, walk, or step. That one word will also help another viewer see that they are not working on it alone. Today, every test was performed in a quiet space while you concentrated on one task at a time. But daily life is rarely that simple. We walk while answering a question. We turn while carrying something. We cross a room while remembering where we left our keys. For some adults, the most important change does not appear until the brain and the legs are working at the same time. In the next video, I will show you a simple walking and thinking assessment, why some people slow down when they begin to talk, and what that change may reveal that an ordinary balance test can miss. If this video helped you understand your movement rather than fear it, subscribe and keep your results. Your goal is not to prove that you are young. Your goal is to protect the freedom to live your own life.